Welcome to the Derm Vet Podcast, where pet skin is always in. I'm Dr. Ashley Bourgeois, board-certified veterinary dermatologist, skin nerd, and your go-to guide for everything itchy, smelly, and inflamed. I'm here to take the itch out of your day and make derm more fun than frustrating. Grab your microscope and let's focus in. You guys asked for it, and she is back, the most frequent guest on the Derm Vet Podcast. Dr. Julia Miller has joined us today and had a quick outfit change, may I mention. So,
Yes.
yes, for those who have seen us on social media, or probably we've talked about on the podcast before because we're kind of weird like that. We're both football fanatics, and we have been very fortunate to have pretty good teams. Me as someone who follows the Chiefs, and then Dr. Miller, who I could not walk anywhere with at VMX in Orlando and not hear "Go Birds." And reigning Super Bowl champions, Philadelphia Eagles fan. But more importantly, besides that, though we are getting very excited for football to be coming up very soon, is that she is here. So welcome once again, I think like the fifth time to the Derm Vet Podcast, Dr. Julia Miller.
Thank you so much. I love being here. I mean, it's the highlight of my day, and
I'm
also
just like,
go
when do you
birds. You know.
just like, yeah, and then, yeah, sure,
Thank you.
fine. And then I'm like basically you're half co-host at this point, but that's good.
Anytime,
That works
girl.
for us. That works
Anytime
for
you want it
us.
to be the derm vets, and we
I
do a
would
little
love it.
spin-off, I'm invested because
Yeah. The
I'll
only
talk with you
hard
any
thing
day
is
about all
this
the things.
the only hard thing is the scheduling, right? Because
Yeah.
it's just like a difficult situation to have to figure out like always the scheduling. But that's okay. We made it
Well,
work. And she is frantically so kind with her time because she is run to the airport after this. So this is just how life goes as two very busy ladies in veterinary dermatology. But I am very excited to have you on because this is something you have a lot more experience about. And there goes my husband. Again, real life. We're real life here. He has to go to work, so he had to grab his stuff.
mm,
Um, and that is to talk about Zarasyl, who's actually a sponsor of this podcast today. And I have used this some, but I will say the first time I heard about Zarasyl was from you. You were telling me all about it. I'm like, what the heck is this product that you love so much? So I think you're going to have a ton of insight to really provide listeners because it's something that you have a lot of experience with. So, let's just kind of start. We'll back up a little bit, right? Because I mentioned this product with a Z word. People are like, what the heck? What are we talking about here? Um, let's just talk about focal infections and wounds. And I
mm.
know as someone who does multiple species, you have a lot of experience with this. As a veterinary dermatologist, let's just talk about some of the frustrations that can happen when we're looking at infections, deep focal infections, or wounds that you're managing.
Yeah, I think a lot of people don't necessarily think of wound healing and dermatology as the same thing, but there is a lot of crossover. Even when we're talking about deep pyoderma, I mean, you've seen those like heavily eroded, crusted lesions. I mean, that is like a little baby wound. So I think we deal with wound healing to some degree almost every day as dermatologists, even in small animal, and then definitely in large animal, because I do a fair bit of horse work. I mean, scratches, distal dermatitis, plain old wounds. I do a ton of wound stuff when it comes to horses as well. So, when I first heard about this particular product, Zarasyl, I was at Cornell and they were thinking about it from more of a wound healing perspective. But I jumped in and was like, hey, from a derm perspective, I love new products. I'd like to find a product that I think would have multiple uses, not just for wound healing, but also for some other things throughout my normal derm day to day. And I've used it in quite a few different things now.
Yeah, and I think you're right. A lot of times traditionally, when I would say like 10 years ago, if you asked me about like really bad wounds, right? The surgeons are often involved and they should be, right? Some of these need grafts. There are certain aspects, but a lot of times they end up being a bit of a co-specialty management where they're kind of managing the aspect of what they need to do, but maybe we're helping either with if we need to go the antibiotic route, antibiotic selection, or other things that we can manage, they can be quite complicated and honestly, like, really difficult depending on location,
Mhm.
depth, underlying cause, right? Like, why is it there in the first place? Sometimes we don't know. So I think that's a really good insight just to think like, yeah, it's the skin that's affected. Like, we do need to have some knowledge and wound healing's on our boards. So I guess we
Yeah.
better know something about it.
Yeah.
Um, and now we're entering this world, right, with, I would say, especially in the last few years, a huge concern about antibiotic usage. And I think
Mhm.
we're seeing a huge shift, right, in the human field, and the veterinary field always kind of follows suit. So when you can, do you prefer to imply and use some like non-antibiotic options in these cases? Like what are the things that you're looking for rather than just throwing them on antibiotics?
I'm always trying to spare antibiotics now if I can, and I feel like that is something that I am actively thinking about more and more every single day, whether it's oral antibiotics or even topical, because we have shown in various studies that there's topical resistance to antimicrobials. There's chlorhexidine resistance out there, which is a frightening thing to think about, honestly. So if I can spare the usage of an antiseptic or an antimicrobial, I am trying to do that. And that is a nice thing about the Zarasyl product is it is antibiotic free. So it's not something that contains any of our traditional antibiotics. It doesn't also have like iodine, betadine, or chlorhexidine in it, some of the more antiseptic things we think about. But yeah, I'm always thinking about that because anytime we can achieve the same end result without having to use an antibiotic to get there, I just feel like is safer for the pet and safer for kind of our whole global community and antimicrobial resistance.
And when we look at other countries, right? So we both practice in the United States, like we are actually one of the, if not the worst at
Hmm.
antimicrobial resistance. Like we compare to other countries, especially when you talk about like Europe and Australia, all those countries involved in those areas and those continents, like they have a lot more restrictions on
Yeah.
what they can use. I remember doing a podcast with someone over in the UK and they don't even have triple antibiotic ointment over the counter. They're like, "Oh,
Wow.
we heard you have like, and maybe that's changed, but this was just like a year or two ago." And they're like, "Oh,
Mm-hmm.
I heard you have things like, like neomycin vaccination." I'm like, "Neosporin?" It's like,
Yeah.
"Yeah." Like she was like, we can't have that." Like over like
Hmm.
that's how regulated they are, right? And we are not that regulated at all. And then there's other countries that are probably even a less so than us. I was with someone practicing, I think in Mexico, and they could get a lot of their prescription medications just like the owner can just walk in and that's it. Like they don't need to
Hmm.
have it. So it's tough as far as like managing that, even when you do have to prescribe it more often or don't. And we're just seeing growing and growing resistance every year. And a lot of times, I think if we do assist the body, right? The body's doing something for infections. There are infections that they just treat on their own. How many times have you had a
Hmm.
case? They're like, oh, they had like, some hair loss and crusting like a few weeks ago, but kind of, it's kind of gone away. And it's like the body's trying,
Hmm.
So what can we do to assist that a little bit better and not just always reach for that?
Yeah.
So you've mentioned Zarasyl. And what is it? Tell us like
Yeah.
the ingredients in it, the basics, kind of how it works. I mean, I have used it some, but I
Yeah.
know that you are an extreme lover of this product. So, tell us a little bit about what is actually in Zarasyl.
Yeah, it's very true that I am a stan. I'll fully admit it. I use it regularly. The Z cream, I think you might have even said the Z cream is what a lot of people I know call it. So what it is it uses amorphous silicate nanoparticles, which are fancy things to say that
Sounded
no,
very, very smart.
thank you. This is what I try to do every day. It sounds smart. I appreciate
Trick
that.
people.
Yeah,
Yeah.
also tricking people 100%. You have figured it out. um, so we've silica or silicate particles have been used in wound healing for years. This is not some brand new technology that's never existed before. This is something that has existed in the wound healing world for a long time. When you think about like burn wounds and things which are really deep and significant, this is technology that's kind of existed for a while. And essentially, what happens is those amorphous silicate particles will then break down and they'll break into a word that I have such a hard time saying, orthosilicic acid. I'm gonna call that OA
Ooh.
because yeah, it's I literally can't say it 10 times fast. I've tried multiple times. But that's the magical ingredient, that orthosilicic acid. Because what that does is that has a lot of different downstream effects. So it's going to do things like regulating growth factors, which is important when we talk about wound healing. It helps increase collagen formation. We all love collagen. I mean, it's not just for beauty, right? Also
Collagen
good
mask
for
every night. Yep.
every night, girl.
Yep.
It's also going to help us with those really important elastin fibers. It also aids in reducing chronic inflammation because it helps with some of our reduce some of the pro-inflammatory mediators out there. And then last but not least, from like a wound healing perspective, it also has an anti-fibrotic action. So we don't want too much, right? When we talk about wound healing, it's this tender balance. Like you want enough collagen, but not too much. You want some fibrin formation, but not too much. So the OA, the orthosilicic acid, really helps regulate all of that and at a very small level. But that's been shown to be effective for a number of years. So that's effectively the mechanism of action of the active ingredients. But the other thing that Zarasyl does, which is really nice, is it has some nice, more inactive ingredients. And that is that it's got the polyethylene glycol in it, which is a humectant. So I think one of my favorite things about this is I call it a cream, and it is cream, salve, whatever you want to call it, but it allows some oxygen to come in. So it's semi-occlusive. It's not fully occlusive. And a lot of us are not a fan of putting on some big old glob of ointment that's going to cover up the wound because we know that you need some oxygenation to get in to help with the healing process. But it's also been shown that you don't want dry wounds. Dry wounds don't heal well either. So it's that nice balance of like some moisture with also allowing some oxygenation in. And I think it's that combination with this product, as well as with that active ingredient, that really helps it be so effective.
As far as using it, how do you kind of instruct people to use it? Let's take a real world scenario. We'll definitely talk about horses at some point. But since I literally have a dog in my lap right now, let's talk about a dog. So we have like a standard allergic dog that has, let's just say, a focal acrylic. How are you going to have the owner apply it, or like what's the frequency? What's the instructions that you write home for them?
Yeah, so I'm a big fan of keeping things simple in general, and once a day use seems to be very effective for this product. So I usually recommend once a day use for it. And I mean, I have a little bottle of it here, but the nice thing about it is it's just like this little sort of cream-ish product. So it goes on really nicely. And when you rub it in, it's not too greasy and it's not too thick. So I just tell people to wash hands or wear gloves always, and then apply a thin layer of the product to the affected lesion, like an acrylic lesion. And then standard procedure, I always tell them to keep the animal distracted for 5 or 10 minutes. If they were to ingest it, it's not going to hurt them, like with most of our topicals. But if they can at least keep them away from it for 5 or 10 minutes to let it absorb, that's ideal. In the case of an acrylic, I'm probably have that dog in a basket muzzle anyway because I want them to stop chewing on their leg. But I usually just have people do it once a day, and then again, wash hands or wear gloves before just to be clean. But it goes on really nicely, and it rubs in really nicely too.
Um, so quick moment. As we are doing more YouTube video stuff with this is perfect because one, you might have a future if veterinary dermatology doesn't work out. I think you might have a future in like hand model or skincare, and your nails look great.
Thank
So
you.
you are right. It's better than me. I like never have my nails done. So you like killed that. So, if it doesn't work out in veterinary dermatology, just know like, the human skin market, you could go there.
I'm
Um,
invested. Side hustle. Let's go.
Perfect. There you go. We all need them, right? So there's no steroids or antibiotics in the product, right? So we've kind of covered that. So what about long-term usage, right? Because we deal with difficult cases. So we
Yes.
deal with cases that kind of, I mean, I'm sure you have them too. I have the cases
Hmm.
where there's a spot that's, like, kind of always gonna be an acrylic that's scarred there, or it's always kind of there, but the rest of the dog's doing good, and that's where we're gonna sit, right? Like, derm is not about perfection, we're about managing, as you and I are very much believers in. So, is this a product that you could safely use long term in those cases, or you could kinda give owners the freedom to use if needed?
Yeah. You mentioned a really important point that it is, we talked about antibiotic free, but it is also steroid free. And I guarantee you feel the same way as me. Chronic, long term steroid usage on the skin gives me a lot of anxiety, to be honest with you. Like, there are certain steroids I feel okay about using very judiciously, but I cannot tell you how many times I've seen topical reactions, thin skin, chronic recurrent infections because of the usage of topical steroids long term. So when we talk about the safety of this product, it is absolutely safe to use daily if you wanted to for a very long time. Partially because it doesn't contain a steroid. And I like that too. We don't want to inhibit any wound healing. We're here trying to kind of help the body along as much as possible. And the steroid free nature of this is also something I really, really like.
Yeah, we have all seen it where there's an over and listen, we're not here to shame like I short-term steroid usage, things like that. Recognizing different potencies of steroids is obviously really important when we're talking about management of skin disease. But we have all had the cases where even if you say, just use it for a week, twice a day,
Yeah.
like they see it works. And then all of a
Yeah.
sudden we all see usually belly, right? Because it's already
Mhm,
naturally thin skin and they get a
mhm.
little infection and the potent topical steroid goes on all the time and they thin their skin out. We can see blood vessels, they get the comedones, and you can't always fully resolve that. Like sometimes
Yeah.
some of that is I don't know if it's scarred's the right word, but it is chronically thin there or it's chronically got damage there. And that can definitely happen. So I think when we're thinking of using topicals, also recognizing the ones that we can give more freedom with.
Yeah.
And I know you and I, again, we practice very similarly, but we're both big believers in giving our owners tools to be proactive, not always
Uh-huh.
reactive. But that's not all topicals. Not all
Yeah.
topicals are safe to do that with. So having products that you can say, listen, go ham, right? Like, you can
Yeah.
go crazy. Like, if they get a little lesion and you can get ahead of it and you don't always have to run in to see me, I love that for you, right? Like,
Yeah.
that's a really great option, but that's not every topical product. We love topicals, but we have to recognize the differences
Mhm.
in what they're trying to achieve. So having
Yeah.
something that we can get freedom with, I think, is really nice from a product standpoint.
Oh, I agree, and I wanna bring up too, I use this in a lot of cats because 'cause I'm really
Oh, yeah.
particular about chronic steroids and cat skin. Because cat skin is already thin, we don't need to make it thinner, and one cat swipe of a claw on thin skin, and you're dealing with, like, this horrible wound. So, I actually use this a fair bit in, like, my eosinophilic granuloma type kitties, the ones who get those lick lesions on their abdomen, or if they'll scratch their face, this is something that I don't worry about, like, if it gets a little bit in their eyes, I'm not concerned about that. So I use it a lot in my cat patients because of the safety aspects of it, and I've been really pleased. And it's also the other nice thing about it is it doesn't have a strong scent, like it isn't scented. I'm a big fan of no scent. So I feel like animals tolerate it well. They don't find it offensive and it does not sting. I can tell I have literally put it on my own open wounds because I am that weirdo that if you tell me a product doesn't sting, I'm gonna like find a scratch and I'm gonna put it on and I'm gonna see if that's accurate. And listen, sometimes it's not accurate. I will tell you that. But I have used this on my own wounds. Don't say that. Yeah, sorry, Zarasyl. But it does not hurt. I promise you, there's no stinging, there's no, like, any discomfort when you put it on. So I think that's really beneficial for helping with that, like, human animal bond, right? We don't want to tell our clients to put a product on that hurts the animal, and then the animal is going to be like, no, thank you. And it's going to wreck their relationship. So this is also nice because it doesn't have any of that negative smell or any of that sort of stinging, burning sensation.
And you find, I mean, cats, right? I mean, we're all looking for things with cats. I mean, I saw like 3 cats yesterday in the clinic and, I'm always telling the owners like, "I know it stinks, like there's not much out, not as much stuff available for them," but it sounds like you've had good experience with this being pretty well tolerated in cats.
Yeah, definitely. Yeah, I use it quite a
And
bit.
that's helpful because 'cause they're so limited sometimes on what they'll accept as far as oral
Mhm,
medications. I do find
mhm.
a lot of my cats are pretty accepting of topicals unless it's a topical, right, that doesn't is just uncomfortable or has a bad scent to it because they're so, like, sensitive with
Yeah.
that type of stuff. What type of cases, like, if you had to kind of pick, like, your top 5, let's say dog, cat, and then maybe we can
Mhm.
identify some horse. I know we have some people
Yeah.
interested in horses listening, and you love the horses. So tell me kind of like your top diseases you kind of feel like you reach for a Zarasil product for.
Yeah, I think there's a difference right between what I think a GP would see more of. So, like, I think this would be great for something like a hotspot. I would definitely see a benefit to that, but I don't, we don't really see a ton of those. The big things I do use it a lot in cats. So definitely for my eosinophilic plaques, eosinophilic granuloma lesions in cats, I'll use it a fair bit. For whatever reason, they love to get kind of non-healing stuff. In my dog world, I've actually used it a few times now in perianal fistulas. Because if you think about it,
Oh,
yeah,
wound.
those are wounds. I mean, those are deep, nasty wounds, and you can pack this stuff in there if you needed to. And I've had some really nice turnarounds on 2 little busted anal glands and then a couple of perianal fistula cases that I've had, so I've really enjoyed it there. I've used it in a few interdigital furunculosis cases. Again, that kind of crosses that like derm wound healing thing, and I've really liked it for in an interdigital furunc. Mostly on the dorsal aspect. Sometimes on the ventral, things can get a little sticky. But on the when they have those nice, dorsal interdigital lesions, I think it works really nicely for that. I have used it for legitimate wounds because we get some weird, deep, infectious things that, almost like paniculitis, focal paniculitis cases. I've used this in actually multiple focal paniculitis cases that I've really enjoyed use there. That's kind of the big stuff so far. Excoriated lesions. I've had some nice luck with that on excoriated lesions. And then a couple times I have used it for focal pyoderma, mostly on the ventrum because it is tough if it's a heavily haired area, just because it is, cream ointmenty. But if you do have a focal pyoderma on the ventrum or somewhere where there's less hair, I've used it in those cases too.
And what about horses? So as a person who loves horses, right? And for those of you who don't know, if you haven't heard her multiple times on the podcast, that was kind of her origin story, right? Like
Yeah.
you did a mixed animal like a large animal
Mhm,
internship and we're a farrier and like all these crazy
mhm,
things. And you work in Kentucky,
mhm.
at one of our clinics. So, you see probably more horses than most of us as dermatologists see. So what are the cases for our friends who do practice on horses that you would use this product for?
Yeah. I feel like I'm the Zarasyl distributing center at the barn that I board my horse at. Like, that's not a joke. I can't tell you how many times people will come up to me and be like, "You got any more of that Zarasyl product?" And I feel like I'm, like, drug dealing or something on
Yeah.
the side.
You're like, it doesn't have
But
to be a secret.
no, no, I'm like, "Guys, here, also, you can get it on the internet if you would like to." So I actually use Zarasyl so much for horses. So and it does Vanna White again, there's a larger horse version because 'cause you're gonna go through it a lot, right? So the companion animal's smaller, the horses are a little bit bigger. But I use it all the time in tons of different things. One of my favorite things is scratches, the distal dermatitis in horses that is just the bane of everyone's existence. I think this product is not to toot its horn, but almost perfect for that because we're not talking about crazy antimicrobials. It's got that sort of semi-occlusive, so it's going to keep it moist enough, but not too moist because that's really important in the horse world. We don't want to over moisten things because it gets really sticky, and then everything gloms onto it in the barn, and you end up with just like a distal limb that looks like one giant caked on dust pile. So the nice thing about this is you can rub it in and absorbs really nicely. So I use it a ton for distal limb dermatitis. I've used it in Habernema lesions, some really difficult to heal Habernema lesions. And then the other big thing that I've recently been using it for is muzzle rubs. So, it's fat pony season here in Kentucky because the green grass is beautiful and gorgeous and there's a lot of horses at my barn that are wearing muzzles and they just get these kind of persistent muzzle rubs from wearing them and I use it a ton in that and I mean it heals those things in like a couple of days. So I have a bottle in my tack trunk, and like I said, I feel like I'm the distributor of the barn because a ton of people are hooked on it now.
So we've talked a lot about using in those situations, right, to avoid things, like antibiotics if we can and, topical steroids, which is great. I guess I also want to recognize concurrent use because
Mhm,
sometimes when we're using topicals, it's great if we can just flat out avoid, right? But we do live in a difficult world where sometimes we need, topicals and maybe systemic therapy. Do you find that you use it in those cases where maybe, yes, you do need something, like you're to the point you need a culture and judiciously pick antibiotics,
mhm,
but is there a point where you would also find the benefits of this as moisture of that lesion being just right, little
yeah,
Goldilocks theory, and having that, OA and all the complicated words you said still be there? Because I think that's the
yeah,
important thing to recognize is we're like, "Oh, topicals, topicals, topicals,"
mhm.
but it doesn't just have to be only that if you've reached the point you have to reach systemic, right? What about, like, lessening duration of antibiotics? Can you speak to that?
Yeah, I would for sure. Derm, the words we say all the time, right, is multimodal therapy. And I think this fits beautifully in with that. There are still a lot of cases that need oral antibiotics. I mean, I just saw a horse that had nasty chronic distal limb vasculitis, and I am using Zarasyl, but you better believe I cultured and I'm going to be using some systemic antibiotics in that horse as well because of the depth of those lesions and the chronicity of those lesions. And they were infected on cytology, which of course I did because you must. And same thing with small animal, right? Like if you need to use systemic antibiotics, if you need to use some systemic steroids also for inflammation relief, or I'll also tell you, there have been times I've used this product in the morning and maybe I do want some topical steroid, but like a judicious amount, just like a specially tailored amount of topical steroid. So I might use the Zarasyl in the morning and then something like Synodic or Mometazone or something like that at night for just a week or so when I do need a little bit of topical steroids. So it is nice because it plays well in the sandbox and you can use it with other products as well. So yeah, I use it as part of multimodal all the time.
Yeah, I think that's just an important thing to recognize because, we're all preaching topicals and we should be. We absolutely should be. We should be relying them more, right, than we used to. We are seeing worse resistance. But I think there's also a lot to be said for these new therapies coming out and also recognizing concurrent use. Like, okay, if
Yeah.
we can lessen our because we're helping the wound heal better,
Hmm.
right? By
Hmm.
giving it a better environment, by all the fancy wound healing stuff that you kind of mentioned, right? Like not having too much fibrosis happen, so it's a crazy scar that's a problem, that could ultimately end up shortening things like duration if you help the body, right?
Mhm.
And we're looking at that. We're seeing that in the human side where, they are starting to be treating shorter amounts. I'm starting to do my
Mhm.
recheck shorter, right? It
Mhm.
used to not be, now I can shamefully say this, and I love to be real world with people. We get stuck in situations where we learn and we practice differently. It
Mhm.
used to be not that crazy for me to have a pretty bad pyoderma and say, here's your 4 weeks, of
Yeah.
antibiotics, like, see you in 4 weeks. And now
Mhm.
I'm much more like 2 weeks. Like,
Yeah.
I want to see you on the antibiotics
Mhm.
because every infection's different. I don't have a magic number, but
Yeah.
I am finding a lot of times I don't need as far, even if they look pretty gnarly, like I maybe don't need it as much. Or if they're not responding as quickly as I want, I need to culture faster, switch things
Mhm.
faster than maybe I used
Mhm.
to. So I do think concurrent use is also an important thing to recognize. Like, yes, maybe you do have to reach for it. We still use them. I don't want to put shame to that. You just want to be thoughtful of how you're using them. And then maybe implementing a product like Zarasyl while you're doing that can
Mhm.
allow you to shorten how much you're having to use it or how long you're having to use it.
Yeah, I love your approach to that. I also really like that recheck coming back in so you can reassess the situation with your eyeballs. I think that's something that is super important in the derm cases from a GP or specialist standpoint. I love that. And we're all just trying to use less of that antibiotic in those cases, and products like this are really beneficial for sure.
Yeah. The last couple of things. So, whenever I get approached or talked to about new things, right, as
Mhm.
scientific people, our first question is, show me the research. Like, what
Yeah.
do you have to actually support that? Can you speak to if there are studies about Zaracyl and its effects? Because I know that really, right, there's so many topicals out there and a lot of them
Yeah.
don't have support. But my understanding is there is some support scientifically
Yeah.
for the product.
Yeah, definitely. I mean, and that's one of the questions that, when I wanted to start using the product, I said the same thing. Tell me more about it. Is it actually going to work, or is this just like, an Instagram video, click here, buy it today, right? And they do have some nice support out there. Number one, there's a lot of support in the human literature on those silicate nanoparticles and what they do. So I love when we can borrow from work that's already been done because let's be honest, skin is very similar in the species. So there's a lot of human stuff, and they actually did a lovely wound healing study. Now it's on horses, but they looked at wounds on the distal limb of horses. It was a study done at Cornell, and they utilized the Zarasil product. And one of the big things they were looking at in that study is did they make proud flesh? Because proud flesh is such a bad thing, right, with our chronic distal limb wounds in horses. And they noticed that there's excellent compliance. Owners were very satisfied, and they did not have any proud flesh in those lesions, which was great. So there definitely is some white paper out there to support the use of the product, and I know for a fact that the company is actively putting their money where their mouth is and pursuing more papers. They're looking at its antibiofilm effects, which is really cool and promising. That's just coming out. They're looking at its antimicrobial effects. So they're really trying hard to put even more white paper proof back out there. But there definitely is already some stuff to support it.
Which is wonderful. My dog just lowered my desk. Uh, this is real life. We're not
I
fancy over
love
here
it.
at the derm vet. She is going crazy right now. I can't do anything without her being attached to me. So that yes, I totally agree with you. We need to have the studies, right? Because anecdotal is great to a point,
Mhm.
but it also helps me from a client standpoint, right? That I can say, listen, I get it. There's so much stuff out there. You go to a pet store, you go to Amazon, you go online. Listen, I do it too. I search things all the time, right?
Mhm.
Online. And there's so much stuff there and great marketing. But here's a product that actually has studies. Here's a product that actually has literature behind it that I can say I've seen cases respond to it. I have friends who've seen cases respond to it. Plus, here's how it works, right? Like, here's
Mhm.
what actually happens. I think that is so important, not only for us to know we're using products that are effective and proven, but also just that we can really back that up with our clients so we can tell them why it's different, than
Yeah.
other things that maybe are available online.
Yeah.
Any last thoughts you have about the product and its use as someone who really enjoys it? Anything else that you want to leave the listeners with about Zarasil?
I mean, I think we've covered a lot of the bases. It's a great thing. I like it. If you're not sure if you like it, try it. That's what I always tell people. But don't try it on just one case and then make your assessment based on one. Like, you know how that goes. I think sometimes in vet med, we're all a little keen to say, oh, great new product. I'm going to try it. And then it doesn't work on like the worst thing you've ever seen. And you're like, well, it's not good. So try it a couple times, try it on a few different things, kind of get the vibe for it. Because I always think personal experience really goes super far. It's nice as far as the cost is concerned. It's nice. It's available, I think, on all the major distributors, which is lovely. And like I said, they've been a really lovely company too. And I will say that I think it is important to, give our business to people who want to create the white paper, who want to help you out. So, reach out to them. They're really lovely human beings, which I think is also a benefit with any product. But yeah, I think we've covered all the big stuff. It's safe to use long term. It's easy to use. It's well tolerated, and it does have a real variety of uses. So that's a nice thing when you're thinking about adding something to your inventory. It's nice to make sure that it can do more than just one thing, so that it's worth putting in there. And that's what I like about this product is it really can cover a number of different uses and different bases.
They're always present at veterinary meetings. I've had several
Hmm.
times I've walked by and talk, and they can really like explain, how it works and what's going on with it. So I totally agree with you. Like those that are supporting our industry, those who are actually
Hmm.
putting research out, asking us like what we want next, right? I
Hmm.
think is super important. And with that, you have made it through another episode. I do have to look, I have it right here. Look at, I see yours in the background, our Labubu that we got when we were teaching in Thailand, our Labubus. For those listening, which is funny, like when we got these last November, it
Yeah.
was, like, huge over where we were in Thailand. We're like, "What is that?" I didn't expect it to blow up to the point it has now. I'm like, "Wow," we were, like, at least in our country, like, felt like kind of ahead of the trend. Though now I'm, like, need
Hmm.
to get a keychain one because I just have, like, my little statue ones that we got so lovingly from our friends in Thailand that sit here with
Hmm.
me while I podcast, but I kind of felt like, I'm never a trendsetter ahead of the game, so I felt a little ahead of the game here.
Listen, I'm gonna go ahead and say full trendsetters. Yes,
Yeah,
you and me, we brought these babies before they were popular. I accept that.
in
Thank you so
America, they
much.
were plenty popular
Oh,
where we
oh,
were.
true.
We were
Very
we were
true.
like,
Very true.
"What are these monster things?" And now I'm like, "How do I get more?" So,
So
yes,
true.
it's pretty cool. They keep me company. But Dr. Miller, thank you so much for your time, for sharing your experience, about Zarasyl. It's always nice to have really good products, different products, like you said, different mechanisms of action,
Mhm.
topicals that we could try to use them on their own, that we have freedom, that without side effects, as you mentioned, that we can give to their owners, and that we can also think about using them concurrently if we do need to reach for antibiotics, that maybe we can still help the body kind of help that wound heal a little faster. So maybe we can at least use it for a shorter amount of time. So I really want to thank you for being on here and also thank Zarasyl for putting out products and research and sponsoring this episode of the Derm Vet Podcast.
Thanks so much for having me. It is always a pleasure, my friend. I wish you a glorious football season.
Yeah.
But
Oh, we're
also,
all we're basically the Kelseys right now.
it's true.
We should tag them. New heights, pick us up.
Oh my
Fan,
God,
you
let's
don't
go.
have too many veterinary dermatologist fan bases, so we'll represent for them.
I'm invested.
Yeah.
Let's do
My
this.
7-year-old still has a crush on Travis Kelce. She kissed a picture
Yeah,
of him last night, so, I told her she's
I
got
get it.
stiff competition, but, we'll take either Kelce brother, really.
You're not wrong.
So,
You're
listen,
not
we
wrong
love
at
some
all.
Kylie, so, we're not fighting with either of their women.
No.
Thanks again.
Thank you.